Your kids are accustomed to seeing a doctor dressed in, I don't know, a shirt and a short pants or long jeans or whatever may be the case. And right in the COVID unit, we're all gowned up. Everything is white and you can only see the eyes. So, and most of them, when they see us, they start to cry. It's something you expect. So, what we try to do, uh, have some jokes with them, ask them some questions they like. We try to entertain them, try to get be more friendly to them, not just go in and listen and what's not. No, we try so that they can know that we're there for them, trying to help them.
Dr. Maxwell Schiller is the acting head of the pediatric unit at the Carl Hushner Memorial Hospital. Beginning in December, the healthcare facility has seen the largest number of pediatric COVID cases since the pandemic began in the country back in March of 2020. But caring at home for children who have tested positive for COVID is no walk in the park, especially if they are just under the age limit for the vaccine. Your options for prevention may be limited.
My youngest son is 11 and he doesn't qualify for the vaccine yet. He was prepared to go and get it. He's dying to go and get it. But unfortunately, we caught COVID before we had that chance. And for him, it physically affected him the most. He had the most symptoms. He had the highest fever. But also, I noticed mentally he was stressed out about it as well. The first night when his fever was so high, I didn't even want to check it. I just knew what I had to do to get it to come down. He said that he didn't want to go to sleep because he was afraid of what was going to happen to him if he went to sleep. So he's the first one in our family to have had it.
Like Carla Ayers Musa, Krista Powell and her entire family also contracted the virus. For Powell's daughter, however, her bout with COVID was a different experience. She had no symptoms, but unfortunately had to be confined to her room and couldn't play or visit with family and friends.
We were one of the first set of individuals that tested before our first wave. So it was, from the beginning, it was very traumatic for all of us because the stigma that was then at that time, even being at the clinics, it was horrible. Like, stay far away, don't come, just come when we're ready to test. Her first instinct, when she had to get swabbed, you had to prep her and tell her, you have to get swabbed. We can't run from it. It's going to hurt, but you got to be brave. You have to be strong, and you do it. So we got tested. We waited our 7 days at the time, and we found out that we were positive. Now, when we went home, it was a little bit difficult because the three of us, we tried to separate ourselves in different rooms. So you're not able to console each other. We did our home remedies.
Both mothers speak of the toll that COVID-19 has had on their children.
We were in it for about 14 days. My older son probably a little bit longer because he tested positive later. He got it last, and so his stress was, oh, why did I have to get sick last? And now we can't do anything, we can't go anywhere. That also played a huge role on them. During COVID, we haven't been going anywhere really. They might go visit their cousins and play ball with their friends, but with things being so restricted, they haven't been able to do that. We think that our children aren't listening. We think that they don't know, but it's all over the news. It's all over whatever social media, whatever games they're playing with their friends. People are dying from COVID. People are in the hospital. So that really had a big impact on him. My husband did his part too, of course. I'm sure most dads do. But it is, typically does fall on the mother. And so it becomes this very exhausting thing.
Dr. Schiller tells parents to do the best they can and stay calm.
The most important part, or the most important thing, is to keep calm. Do not panic, all right? Because our pediatric cases are more likely to be mild or moderate. Most of the time, mild. Okay, so that means that you won't panic and you will say, oh my God, my kid have COVID, I want to get frightened, I want to do this. No, keep calm. Behave as you behave as normal as you can be around him. Always make sure you use your mask if your child is COVID positive. And hydrate.
I think the biggest thing for me was that I couldn't panic. And when you see a very high fever, or my older son who had a terrible cough and couldn't catch his breath and felt like he was going to throw up, I have to be very calm, even though inside I'm terrified. You know, it's the middle of the night and we're sick, and you know, you can't just, it's not as easy to rush out to the hospital when you have COVID. So managing those things, I had to just remember that the doctors were telling me what I had to do. We were doing everything we had to do. And so just to try to be as calm as possible so that the kids could feel calm and safe.
Duane Moody for News 5.